Hi, Namig.
Hello.
Before we get started, I'm just gonna ask that you're okay with me sharing this video that we're making with my classmates from HP531 Clinical Medicine 1.
Yes, it's okay.
Okay. And I've been hearing you have some lower back pain.
Yeah.
How did that happen?
While weightlifting session, I was doing some deadlifts, and since then I was experiencing some lower back pain.
Okay. And would you say that it's kind of interfering with your everyday life?
Out of 10, I would say 3, as I'm experiencing some pain when I'm trying to change the position of me sleeping or sitting sometimes. But like overall, it usually doesn't show itself when I'm walking, I'm doing work, so it's pretty well.
It's manageable? Okay.
It's manageable.
Well, I just wanted to talk to you, I think, about some ways we can help you reduce this pain from more of a psychological point of view, and then also work to later on, you will work on some physical changes that you can make. And I think it's important for anyone who is experiencing pain to understand how this pain is produced. So we have these special receptors in your skin all over your body that whenever they feel like there's a change or to your environment or they sense danger, they send a signal to your brain where then the signal is being interpreted as something that can be dangerous or not. And then if your brain decides that it is going to be dangerous, then it makes you feel the pain. So that's why sometimes if there's no pain, the brain can amplify this information. Or sometimes if you did hurt yourself, it doesn't always start hurting right away. And just a bit of a better overview of how this works is that, again, what I said, the little receptors in your skin send this information up your spinal cord, up the nerves to your brain, and then something that you've experienced before, if there was a similar experience in your life that you had that caused danger, or a stressful event that happened in your life, or even an emotional response, can all make you feel pain. And then there's also a lot of things that can affect pain. So I know as a student, it can be really stressful around midterms because you feel a lot of pressure. So stress can increase how you feel pain and the amount of pain that you feel. Poor sleep, which also I assume you don't get as much as you should be with being in midterms. Or I hope you do. But all of those things and then poor nutrition and lack of exercise can also increase the amount of pain that you feel. And on the other side, getting adequate sleep and then being active, eating well can all decrease how much pain you feel. I think also us talking about pain as a concept right now and allowing it to be a normal experience that everyone has also makes your brain more calm towards this information, and so it helps you manage how you perceive pain and how much you feel it. I think the overall overarching picture is that everyone experiences pain and any sort of pain is real, but it doesn't always mean that there's harm to your tissues or there's harm to any of your systems. And every person has a completely unique experience of pain, which is why different people have different pain tolerances, and any sort of pain should be treated equally and taken into account. Some things that you can do to help you manage this pain is obviously the education process of understanding how it works, doing some exercises that we call them aerobic exercises. So it's more lower intensity, no weight, but longer duration of time. So your body has oxygen that it can use that can decrease how much pain you feel, get some blood moving, get some decrease that pain experience. understanding how pain works can also help you take control back over how you feel. And I think overall it's important to keep your habits, your regular habits, and those will help you get back to your normal life as fast as possible. And I think that was it for me. Do you have any questions for me?
Yeah, how do I apply all this knowledge to my situation? Like, do I need to stop doing weightlifting? Do I need to start doing cardio exercises more? Maybe over the weights with
Yeah.
working on?
I think so. Definitely, to before you start doing your weight training, do some cardio to decrease the sensation of pain and work on strengthening those muscles. So decreasing the weight, but also strengthening your core muscles and strengthening your lower back. Maybe see a physical therapist too. That can definitely help. And again, what I was talking about, understanding that it's okay to feel pain and it doesn't mean that you're in danger, but it's important to understand that we are here to help you treat it.
Thank you.
Okay, thanks.